Hello, I'm Dr. Chitnis, Kishore Chitnis, practicing at Dr. Maltibai Chitnis Hospital since last 46 years. So I'll be completing 47th. Today I'm here to say something about the bleeding of, the menstrual problems of a woman at the age of 35 to 45, and few of them are unmarried also, and few are girls also of 17 to 25 years of age. And then at the age of 35, when she starts getting menstrual periods heavily, then she is scared of. Now, because of our lifestyle, this particular problem has arisen because every lady has to work for hours together. Now, this particular problem is called as DUB, that is dysfunctional uterine bleeding. Means it's a heavy bleeding. So many times there are clots, there are certain cystic changes and cystic balloon like things, small balloon like things which come out of the along with the clots, and they are scared of why this has happened when it was not there previously. So they come and tell me the things, these are the things. Now, when I examine her, usually what happens ki at this particular age, when once the family is complete, they go to so many doctors, and so many doctors they advise ki now the family is complete. Why you want to go in such a thing like this? Because you will get anemia, you will get all these things, and then so many things arise. So better take out the uterus and be quiet about the things. But when they come to me, as I have gone through so many ladies of this particular ages, the problem remains. Like once the uterus is out, the lady has the problem of the mood changes. As I examine the ladies in this particular week, the major thing which I noticed in this particular ladies and compared to the ladies who are getting a normal period is the lining of the uterus, that is called as endometrium. So endometrial lining is the major problem for this particular bleeding, and this is called as dysfunctional uterine bleeding. What happens is there is a thickening of the endometrium, which becomes, which is called as cystic hyperplastic endometrium. Now, which sometimes it is 23 mm to 35 mm to 40 mm, and which has a very big surface. And once the ovarian hormones act upon them, they start bleeding from everywhere, and the bleeding becomes very heavy, and the clots which are there, they are formed, as which is a natural thing to happen. They come out along with the endometrial pieces, and once they come out, they are scared of it because it contains the balloon like things, small balloon like things, and which is the hyperplasia of the endometrium things which comes out. Now, these particular problems, once I see previously, I also used to think it is better to take out the uterus rather than treat her. But now there are something specific treatments have come. Now, once we give those tablets, now this is only tablet. We don't have to give any injections or anything First few months, yes, you have to give the regularization tablets along with it. That is 21 tablets packs. So the lady has to take daily one tablet and stop the bleeding immediately. And then the tablets which are there specifically, which are given to them, has to be taken twice a week only twice a week for first 8 to 10 weeks, and then once in a week. Now this treatment I have designed for these particular ladies. Now first 10 weeks we have to give twice a week. The other 10 weeks I have to give once a week for 10 weeks, and then once in 10 days one tablet, that is 3 tablets in a month for another 6 months or so. And as I have observed since last few years, once these ladies come back in the, because they so many times after stopping the 21 tablets packs, patients may not get periods for 3 to 4 months or so. And when they come back, and once I examine and do the sonography, I come to know that the thickness of endometrium is considerably reduced. Once it is 25 mm, once I saw, and now it is 12 mm, 13 mm, less than that also. And that is the reason why patients, they don't bleed more. Even the cystic hyperplasia reduces and endometriums almost become normal. In that particular sense, and after giving this particular treatment, I have seen so many ladies and so many uterus. And the major causes of this particular thing is our lifestyle changes. And once these hormonal changes they occur, the major problem first and foremost is this dysfunctional uterine bleeding, and which is heavy. And then the problems of dysfunctional bleeding is anemia majorly because loss of blood. So we have to treat this as well as the anemia part. So many times the ladies, they don't come. They are afraid of going to a doctor because this particular, so many times they are advised to take out the uterus. In this particular sense, if a lady comes to you, you have to see in a proper manner, see what it is, and then treat the lady. And as the treatment is available for this particular thing, that is dysfunctional uterine bleeding, you can definitely revert back the condition to a normal one so that the lady gets her normal periods and becomes all right. Thank you very much for the time given to me.